Hello and welcome to my YouTube channel. Today I'll be taking us through another in a series. This time around, we'll be looking at a specific diagnosis, looking at the question, and then increasing the level of complexity as we move along. Once more, this is a video particularly for medical professionals. However, if you're not a medical doctor, nurse, or pharmacist, you can still watch the video. You will learn, but I won't be able to explain. I won't be going through or breaking down the medical terms, but I'll put a link for us to watch a video concerning this diagnosis or this particular condition. Also, this is not for self-medication purposes. If you have these complaints, please see a doctor. So it states that a 66-year-old lady presented with a history of left knee pain for 6 months. She recalls that 10 years ago, she was involved in a road traffic accident involving the same knee. She experiences morning stiffness lasting 30 minutes and has observed occasional swelling. On the 10-point scale in terms of severity of pain, it's at 8 while in motion, or that's while walking, but 3 on waking in the morning. What's the likely diagnosis? Now we look at a number of things here. Number one, the age of the patient. Number two, the duration of symptoms. Number three, the fact that this patient had a road traffic accident or some form of trauma in the past. And then morning stiffness can occur in conditions like osteoarthritis, but will be less than 30 minutes or less, versus in rheumatoid arthritis where it's more than an hour. And then if you're looking at the risk factors here, the age of the patient, the gender of the patient, and again, the previous road traffic accident. So what's the most likely diagnosis? It will be osteoarthritis. Like I said, I'll put a link concerning osteoarthritis so you could watch. So what are the learning points? Number one, her age and previous road traffic accident are risk factors. Number two, morning stiffness can occur in osteoarthritis, but you will usually be less than 30 minutes or less. Pain was while moving or while in motion is what we call mechanical pain versus pain that occurs in, say, rheumatoid arthritis. This time around, in mechanical kind of pain in osteoarthritis, the pain is worse while you are using it versus in an inflammatory arthritis where the pain is worse after a period of inactivity. So if this patient also has osteoarthritis of the hands, which joints will most likely be affected? The joints that will be affected will be what we call the DIP, that's this joint here, the PIP, and then the MCP joints. Now, particularly the PIP and the DIP will be involved if the patient has osteoarthritis of the hands, less so with the MCPs. But in before the slides are over, you will see where the MCPs will come in. In which other rheumatological condition will DIPs as these joints be involved? Conditions like psoriatic arthritis and then sometimes gout could actually involve DIP joints. What will the left knee x-ray show in this patient? For a patient that has osteoarthritis, these are the findings that the radiologist could report. Osteophytes, subchondral cyst, subchondral sclerosis, joint space narrowing, and intercondylar spiking. If this patient has a condition called hemochromatosis, which additional joints in the hands could be affected? Hemochromatosis simply means iron overload. In patients that have hemochromatosis, the second, that's this joint, and the third, MCP joint, would particularly be affected. I hope you've learned something today, and I look forward to seeing you in another video. If you haven't subscribed so far, please do so before you go. Thank you, and see you again.